It's John Holmes here at 22 minutes past 5 now. Today, the Health Secretary Matt Hancock has confirmed Public Health England will be replaced by a new body focused on preparing for external threats, like pandemics, for example. Baroness Dido Harding, who runs NHS Test and Trace in England, will be the interim chief of the new National Institute for Health Protection. Public Health England has come under some intense scrutiny of its coronavirus response, of course. Let's speak to Andrew Sharp from Health Watch West Berkshire joins me on the show now. Thank you for coming on, Andrew. For people who aren't health experts, it's a little bit confusing, this, isn't it?
It really is, Jono. And I have to say, as a semi-health expert, I don't want to class myself as anything I'm absolutely not. It does seem a bit unusual, really. I can sort of relate. I've heard it related to reorganising the fire service while you're in the Great Fire of London. Timing is often everything, but also Public Health England do such a range of services. The pandemic is only one. They're the sort of people that make sure that, people get immunised for flu, that measles outbreaks get controlled, that kids get their vaccinations, that people, who need to help with stopping smoking or weight management, it's a huge range of services, and the pandemic is only one of them. So, while the attention is very much on the pandemic, the incredible work they do elsewhere, locally and nationally, it's a bit of an odd one from our perspective in terms of timing and the fact it seems to be going very, very quickly.
And I'm sure your fear is that we'll be worse off because of this.
Well, I think the fear for me is, the pandemics, we've never been in a pandemic like this, so it's very difficult to judge what's good, what isn't. But we do know where we are in terms of flu, measles, and all the other services I was talking about. You have some real scientific experts here with epidemiology and microbiologists doing all sorts of other things at the same time. And there hasn't been much talk about what's happening with that. And the other really important thing, which really focuses our attention, is the NHS long-term plan, which everyone can probably remember before the pandemic, was all about transforming healthcare, and prevention was absolutely at the heart of it, because if we keep getting sick at the same rate, it basically can't cope. So it was public health's key role to try and get us fitter, stay well for longer. And those are really important things, making these nudges to people's lives to make them walk a bit further, eat slightly differently. And that hasn't really been talked about. So the pandemic's been really difficult. I'm pretty sure that everyone would agree not everything has gone as well as it might in terms of testing and tracing. But this does seem to be a bit of a rush for such a really important agency to just be changed while we're in the middle of things. So difficult to know at this stage. And also it's been somewhat starved of resources. So prevention's always been the Cinderella of health. And people need to think that people are ending up in hospital to some extent. The agenda's failed. You want to keep people out of hospital as long as you can and as fit and active as they can as long as you like. And that's public health's job.
And what do we know, Andrew, about the new National Institute for Health Protection, as it's being called?
Well, not a great deal at the moment, because, it's a pretty brief statement and conference. And of course, it's very much sort of focusing on these external threats. And even that's a bit of an odd phase, because I understand the pandemic would be seen as an external threat because it comes in from somewhere else and then spreads through the population. But, treatment for cancer, treatment for flu outbreaks, is that an external threat? Obesity, is that an external threat? So it seems to be very much being sold on this sort of pandemic response. But, 10% of the NHS budget is spent on diabetes treatment. So, if we could halve the effect of that, all of a sudden there's quite a lot of money for other things. So it's a really tough one on what we've been told to sort of take a judgment call. And the timing, everyone has sort of said, interesting time to do this, when you're right in the thick of it.
I suppose time will tell, I suppose, if it was the right move.
I think we've probably got to watch and wait and see if, as part of this sort of change, whether maybe there's a little bit more resources, because prevention long term is a real key for us, as well as obviously controlling the pandemic and dealing with that.
All right, Andrew, thank you for your time this afternoon. That's Andrew Sharp from Healthwatch West Berkshire joining me on the show.